Let's learn about other mechanism of labor. In previous lecture we discussed engagement process and descent. Okay, now descent. Okay, when cervix unfolded, okay, now cervix is widely open, approximately 10 centimeter dilatation happen. Okay, which moving further, stretching of walls of pelvis, and then head comes at pelvic floor, which roof of maternal pelvis. Okay, in engagement, head attached with pelvic inlet, then pelvic cavity 0/5, then it become descent, rotation into anterior posterior diameter. Okay, now what happen at this part? Internal rotation. Okay, now see, first I already explained you before. First, what happened? Occipitolateral position, either left side or right side. Okay, we are talking about normal labor mechanism. That's why. So, presentation is cephalic presentation, and presentation part is vertex. Okay, vertex part. As I told you before, topmost part of parietal bone. So what happen in internal rotation? Internal rotation when descent and flexion is complete. Okay, and then now head attached with pelvic floor. Okay, now delivery of head will be happen soon. For that, head needs to rotate, because head cannot be, see, a minor gap and baby's head. Okay, minor gap and baby's head. If baby glide simultaneously at its own pathway, then what happens? CPD, cephalopelvic disproportion, might cephalic this part, okay, vertex part, will get injured with pelvic floor. Okay, so in internal rotation, what happen? First, it is very complex. As you can see, head needs to come out. Okay, head needs to come out. It is very complex but easy to describe. As you can see, a ball needs to come out with smaller gap. So what happened? Ball cannot glide simultaneously in one line. Ball needs to be rotate. Okay, why rotate? Because it can be folded inside, so ball can easily pass out in rotate motion. In this, head is our ball. Okay, and cervix, external orifice. This one internal and this one is a external orifice, and this one is a vaginal canal. From cervix, okay, it engage. Okay, external orifice got engaged, and now baby in between cavity. Now it comes in a descent part at pelvic floor. Now it has to be rotated in this through vaginal canal when crowning happen. Okay, I will explain it later. Okay, so what happen in an internal rotation? Internal rotation, as I explained, this complex but easy to describe. First, occipitolateral position, occiput part at lateral side, either left side or right side. Okay, this side, this occiput part. Okay, on pelvic floor and rotating. See, deeply engagement, then descent, flex, and then pelvic floor rotating. See, this occipital part, as you can see, on lateral side. Okay, it can be on left side or right side. Okay, this occiput part. Now this one is a oblique diameter. Okay, if you have learned about maternal pelvis, then you know the maternal pelvis diameter. Okay, as well as you should also learn about fetal skull diameter. Okay, if you want to learn them both, you can comment. So this occiput part in oblique line. Okay, oblique line. Now it comes at rotate side, and rotate side where there will be anterior rotation on anterior side, 2/8 of circle of the occiput where in oblique. Okay, the rotation is now 1/4 8 of circle, placing the occiput behind. Now occiput goes in behind where symphysis pubis occurs. Symphysis pubis is a part when two pubis bone are attached and make angle. Okay, it is a anterior part of pelvic floor. So that occiput behind symphysis pubis, during internal rotation there is also torsion on neck, which is explained as follow. Okay, first we have to summarize internal rotation, then we will moving forward to torsion of neck. Okay, so what happen in an internal rotation? First, this occiput part on lateral side. Okay, this occiput part, as you can see, in a lateral position, either left side or right side, and then anterior rotation happens. See this part, the 2/8 circle of the occiput in oblique line, now moving forward in 1/8 of a circle, placing the occiput behind at the symphysis pubis, as you can see, and during the internal rotation. And then torsion of neck also occur. Okay, so this one is an internal rotation. Now next we will move forward to torsion of the neck, which we will later in next part. Till then, happy learning.